All right, we're starting in a sideline position and we're going to be doing a sideline drape. But the first thing that we're going to be doing is pillowing our person up for comfort in sideline. So we're taking this position and assuming this person is going to be here for a large duration of the treatment. So we're going to be pillowing up and checking on the neck as well as the low back and both legs as well as the arm. And so we're going to be placing multiple pillows trying to make sure that this is a comfortable position for a person to spend 20, 30, even 45 minutes of a treatment. The first thing that I'm going to be doing is checking the neck. So I started with a large pillow here. We had our client get on the table without us, and this is a variable height. So what I'm going to be doing, I'm just going to fold back the sheet on your low back a little bit, is we want to assess how the spine looks in a sideline position. So basically we're looking at this height of the shoulder and does this neck go in a comfortable position. If you start with a standard neck pillow, here's an example. This one is not really that large, and that space between the head and the shoulder is probably not enough. So I decided to start off with a thicker pillow. And a lot of people sleep in a sideline position and they usually take a big large pillow like this and kind of fold it underneath their neck. So this really is a comfort thing, but we might need to adjust the height by using additional pillows or towels to make that this height is comfortable but also in a good alignment for the cervical spine. So that's going to be our first check. The second component that I'm going to be doing is handing our body what we like to call a hugging pillow. So I've taken one pillow and put it in a pillowcase, and I actually like to get a flat, smaller pillow. There's a few different ways that people do this, but for myself, I'm going to give them an option. So one, I like to fold this pillow in half so it covers less surface area, and I'm going to kind of demo this. But the body's basically going to be hugging onto this pillow, which is what we call it, a hugging pillow. But if you leave it lengthwise, it actually covers a lot and it might get into your draping a little bit more. So I prefer to take a smaller flat one and fold it in half. Now there is two options. Some people feel more comfortable just literally handing it to your client over top of the sheet and they can hug onto that. And now you can just basically leave it there, or you can actually take this and place it underneath the sheet, and since it's wrapped, it can go right up against their body. So I will demonstrate that as well too. So if their arms are still in, this will change it a little bit. So let's just ask her to bring her arm underneath. She's gonna grab this pillow and pull it up against her chest here, and then again, we can readjust. So even if this is open a little bit, as you can see, the pillow is up against the chest, and so there won't be any exposure. And I can fold this back over like so. So this is going to be our starting position kind of for that shoulder. This helps to give support for rotators, giving a little bit of support to the shoulder, but it also is something nice to hug up against breast tissue so there is no exposure. All right, so we've looked at the neck, we've looked at this upper shoulder, and now we're going to be pillowing the legs up. So we're going to come down to the bottom of the table here. And what I'm going to do is I'm going to unfold the sheet so I can see both of the feet and the legs. Now in this instance, we're not going to be pillowing the legs together this way because I want to be able to easily undrape both of them. So what I'm going to ask of my client is that they're going to bring their top leg forward like so, and they're going to bring their back leg and almost bring it straight out behind them. Exactly like this. Okay, so now this is going to be the position, but what you'll notice is if we don't have our client centered and they have longer limbs, it might actually bring them so they're really close to the edge, and it might feel like they might want to drop off. Where if I was to do a quick assessment to the back of the table, I still have extra table at the posterior part. So before I go any further, what I'm going to do is come around and I'm going to give her a tactile cue and basically say, please move towards me until you bump up against the back of my knuckles here or the back of my forearm. Good. So now they're not right on the edge, but I put them in a position that's going to make it maximum use of the table. And just to make sure there's no exposure, I'm just going to tuck the sheet underneath the gluteal here while I adjust and move the sheets around. All right, so going back to our 2 legs, I'm going to be pillowing both of these legs, but I am going to start off with this leg here. And our objective is to try to bring this thigh into a neutral position. So we're going to be placing multiple pillows underneath this leg, trying to raise it up to try and neutralize the pelvis a little bit. So I'm going to be undraping the leg here, giving me access to that whole lower extremity from the knee to the ankle. And what we've done is we've placed multiple pillows inside one pillowcase, and I like to have the opening towards the bottom and so the closed part towards the top. And I'm going to have it at the end of the table, so when I lift this leg up, it's going to make it easier for me to slide this pillow up into place. So that's what I'm going to do now. I'm going to reach underneath, picking up the knee as well as the ankle. I'm going to raise that leg up, therefore I can still reach behind me here, grab my pillow, and slide it up underneath the leg. And I can bring the leg back down. So the objective of this pillow, again, is to support the ankle as well as the knee and try to bring this hip up to a neutral position. If we need to, again, I will just kind of demonstrate with my arm. If I wanted to add an additional pillow and you've got to this point, you could actually lift up the pillowcase area and lift up a little bit higher with an additional pillow. But for today, I think this height is good. Another thing to look out for, if you have really long lower limbs, I'll kind of demonstrate that the knee is on the pillow, but now the ankle is unsupported. And so this is, again, not really what we want to see, that an ankle that doesn't have any support in it and it's putting a little bit of pressure on the joint. So if you do have a really long limb, you can actually take a towel, fold it up, and place it underneath at the bottom, giving you almost kind of like a little bit of a longer pillow. So now I'm still giving a nice height, and the whole limb, including the knee and the ankle, are supported. I'm going to ask my client if they feel comfortable with kind of the leg in the position that it's in, and if they agree to that, then we're going to re-drape this limb here. And lastly, we're going to come down and look at this ankle at the bottom here. So again, a lot of times we pillow empty spaces, and in the moment this leg is up in the air and it's not actually being supported, or for some people they'll actually be forced into some inversion. So we're actually going to try to pillow this location as well. So I'm going to grab one of our cervical pillows. I'm going to pick up the ankle and place that, again, not forcing the foot into inversion, but just putting a support across the ankle. You can also use a towel if you wanted to for that. And that's going to be good for both of those lower extremities, and I will cover our individual back out. So this is our start position, as I like to call it. Our body is on the table. We have pillows underneath the neck and the head, underneath the shoulder for them to hug onto, and we've pillowed up both of their legs in this moment. And this will be where we go into some draping. We're going to be undraping the back in this sideline position. So I'm going to be undraping the full back plus this upper extremity because I'd like access to move the shoulder around and move the scapula around. If the arm is still underneath the draping, it's going to make that extremely challenging. So the first thing I'm going to do, coming around to the front side here, is that we're going to ask our individual to bring their arm up and out. So they're going to raise their arm straight up above their head. And as they do so, you're going to tuck the sheet underneath their axilla. You're going to take the front corner of the sheet. I'm going to ask them to lift up their head and neck, and I'm going to tuck it underneath their head. So this is actually creating a bit of an anchor so that the sheet can be held, and now it's going through the axilla, so I won't have any breast tissue or chest exposure while we're doing this. I'm going to come around to the back. So in some instances, if you're wanting to work on just the neck and the rotator, you could tuck it in, and this gives you access to treat this area, but we're actually looking to undrape the back as well. So the next step is that I'm going to go down to the lower part of our drape. which is going to be, again, in around our PSIS level. And I want to go below that, and I'm going to tuck the sheet underneath the gluteal area. So now I know as I undo this back drape, I won't have any gluteal exposure. So that's tucked in. I'm going to reach and grab this upper corner, and I'm going to fold it all the way up and across, basically as far as it goes. So we'll kind of give you that representation here. And that's going to be anchored underneath the armpit and underneath their neck, and now at around their PSIS and underneath the glute. I'm going to start in this bottom corner, and I'm actually going to take this sheet and I'm going to start to roll it up in on itself. So I'm folding it in, I'm tucking it in, and I want to make this a nice tight roll that goes all the way along the iliac kind of crest and PSIS. If they're wearing undergarment, again, asking permission to tuck in so I can just start to see her PSIS here and here on either side, and that brings it up. There's a couple options with this fold here. Some people like extremely neat sheets, so I'm actually just gonna tuck that in up out of the way, and now I have nice crisp clean lines without any extra edges. And I always like to add additional towel just to stabilize in our sheets here. So I'm going to lay this across the body, and we're going to start by tucking it underneath the glute area, fold it into the top of the sheet, holding it in place, and the weight of that will hold our drape in place for when we're working on the back. So this gives us access to working into the low back as well as along the side of the body here for latissimus dorsi, as well as we can just start to get towards the edge of serratus anterior and a little bit of the lateral abdominals. At this point, I'm also going to kind of show you that we can now see that the back has a little bit of a concave dip that's happening inside of it. So one thing I haven't mentioned previously, that if you're noticing that the spine is starting to dip down a little bit from this position, that we could always come in and try to add in a lift. So we can place a towel or a pillow into this area to try and help lift the spine up, which starts to neutralize a little bit of this bend in here. So I'm going to give you an example of that. So we have our cervical pillow. I'm actually going to go underneath the bottom sheet here. I'm going to ask my person to do a little bit of a side lift. We're going to try to tuck that underneath their body, like so. And then I'm going to fold that back. And what you can notice is that it's brought the spine up a little bit inside that lumbar area and started to support the lumbar spine. Obviously, this needs to be a comfort thing for your client. So if they don't find that comfortable, then you can take it out. And in the future, if you know your client's going to need this from the beginning, you might start with this on the table when they lay down in a sideline position. So I'm going to take that out now. So again, I'm going to fold this forward. I'm going to ask them to do a little bit of a lift again, and we'll slide our pillow out of the way. All right, so this is our back as well as upper arm drape.
Fancy.
Or you can just do that.
We're going to be undraping this top leg and bringing it up into a high gluteal drape. So we're going to be trying to getting up towards this iliac crest, towards the sacrum, and again, I'm going to be exposing and undraping, I should say, more of the gluteal, which we've talked about with our client, and she is okay with that. So the first thing I'm going to do is just lay out a boundary for myself. So I'm going to be taking this towel and laying it across the upper part of their body with that bottom edge close to their iliac crest. And I am going to start by tucking underneath the glute area here, just to make sure that this part of the body doesn't get exposed while I'm undraping the top part here. So this is going to be a series of steps. I'll try to do this nice and slow. But the first thing that we're going to be doing is undraping this front leg kind of on the top part. So I'm going to bring the sheet forward, undraping above the knee, and I want to keep this edge really close by so that I have this part undraped currently right now. And I'm going to be taking this sheet going underneath the leg and bringing it up towards the abdominal area. So that's going to be the next step. So I'm going to reach underneath. I prefer to reach in from the front so that I can have the ankle to the back of my forearm. And I'm showing you my thumb because I'm going to place that in the back of the knee while I put my palm and my fingers towards the front. So my thumb's in the back and my fingers are in the front, which means I can pick it up. I'm going to reach underneath, grab this edge of sheet, and I'm going to slowly pull more and more material through until I've pulled at least one corner and halfway towards the next. And I'll explain that in a second. So I'm gonna bring this leg back down. So this was the bottom of your sheet, and I'm approximately halfway, so I'm happy with that, of bringing that up. So I've grabbed from this corner and slid it up so that we are approximately halfway at the thigh. Okay. So we're going to leave that edge alone, and I want to show you these two edges. So this is what I just was holding on to and pulling up, but now I want to show you these two edges, and we're going to be sliding this up the inside of the thigh towards the groin, slowly undraping the thigh. But I prefer to do this from behind. So I'm going to come around to the back side. Grabbing again that edge of the sheet and this edge of the sheet, and without doing too much of a back and forth, kind of causing a little bit of a burn, I want to shimmy the sheet all the way up the inside of the thigh as far as I can go, and it actually feels like I've got all the way up to the inside of the thigh. So therefore, I like to call this the fan. So you still have coverage over the low abdomen groin area, but of course I have my towel there as secondary. So I've brought this all the way up, and if we need to, we can pull a little bit more forward. And now I have a lot of additional extra material that I need to get out of my way. So similar to other leg drapes, I'm going to hold these two pieces of material together in a pinch point. So it's a full circle around the thigh. And with my other hand, I'm going to be pulling the excess material out of the way. So I need to get this up out of the way so it doesn't end up going into the actual drape line. So I'm going to pull and bring this material up and back. And now I'm going to go kind of around the hamstring, mid-thigh, and I'm going to again shimmy up a little bit and starting to expose a little bit of the gluteals into the drape. As we've gotten as far as we can in this fashion, now I need to do some tucking and folding. So similar, if you've watched the other high leg drapes before, I'm actually going to cover the two over top of each other, which I've done right here. So one part covered over by the other part, and then I'm going to tuck the two in and pull and fold in and lift. And I'm going to go lower on that same drape line, tuck, fold, lift, tuck, fold, lift, and I'm going to repeat this process numerous times along the whole ring. This is getting tighter and tighter and tighter, which is giving me a nice, strong, secure drape that I know isn't going to slide down on me. Okay, here's the edge of the sacrum. So I've brought this drape almost all the way up to the lateral border of the sacrum. I have the ASIS and the iliac tuberculum around here, and here is her greater trochanter. So I have a large amount of gluteus medius and tensor fasciae lata and a little bit of glute max access from this drape. At this point, I still have concerns that if I'm treating in this area, this drape might start to slide down on me. So my towel is in close proximity, so I'm going to fold it over the top, and the first thing I like to do is anchor it. So similar to the sheet that's already been anchored, I'm going to tuck the towel underneath the low back and the glute. We're going to pull it tight up and forward, and then I'm going to tuck it into the top of my drape line. Again, further securing the top of this so that I know it's not going to start sliding down on me. So make sure that feels nice and snug, which it does. And the last step, I'm going to come around towards the front. I'm not going to be moving this leg around too much, so the towel can really hang forward, or if you really want to just kind of neaten it up a little bit, you can lift up the knee and tuck underneath the knee a little bit if you're not going to move it. So now I have a undraped upper thigh as well as gluteal all the way to the knee. It's a nice tight drape, and I have full access to that lower extremity. And the last step here, again, I want to keep our client warm, and I don't want to have a leg undraped, so I'm going to take that bottom sheet, I'm going to fold it over top, and I can just tuck it in along the leg. So now the only thing that our client has undraped at the moment is that lower extremity that I want to work on. I'm going to point out one thing. As we've done this drape, we've kind of shifted our pillows a little bit, so this leg is slanting forward in this direction. So just be mindful that's starting to put some internal rotation into the leg, and the foot was actually off this towel. So what I can do is just make sure that my pillows are in the right place. So I might have to move them forward a little bit, might have to adjust them a little bit, or you might have to go in and put another lift. So we could again take this towel and put it underneath the knee if we needed to, just to make sure that we're now getting close to our more level across all the sides. So this looks like the hip is in a nice comfortable position for me to go in and start using some techniques on it. This is going to conclude kind of our undraping of the upper leg in a sideline position. All right, we're going to be undraping the bottom leg now in a sideline position. So in this case, I'm using this specific pillowing, so I'm able to undrape this. And if you use a sideline where you actually have a pillow between the knees, you're unable to undrape the bottom leg. But in this pillowing position with the top leg up and forward, when pillowed up, I'm now going to be able to undrape this bottom leg. So we're going to be showing you how to undrape this bottom leg as best we can. We're not going to be able to go a really high leg drape, but I am going to be trying to get as close as I can towards the hamstring attachment on the ischial tuberosity in this area. So the first thing that I'm going to do is take our sheet and move it in front of this leg. Now what can start to happen is the pillow from this top leg is going to get kind of in my way. So I'm actually just going to ask to pick up their leg and move it back towards me a little bit, like so, giving me that space just to slide that sheet down in between. But I want to make sure my edge is still really close at hand for me to grab onto. Now the next part is often an error, and what you'll see is if I start to pull this, it's actually going to start to expose the gluteal on this side, and I do not want that since we're only going to be coming up towards the ischial tuberosity. So I want to make sure that I've tucked this underneath, so the drape is going to only be able to come up to about that location. Okay, so we're going to go back to picking up the leg now. So I'm going to reach from behind, go underneath. In this movement, I am lifting the leg up into adduction, and some people are going to find this uncomfortable, and you are kind of limited in the amount of lift that you can have. So an alternative option is to add some flexion in the knee. So as you lift it up, you're actually adding some rotation instead of pure adduction, and so it gives you a little bit more space to reach underneath. So I'm going to reach underneath, grabbing the edge of that sheet, and I'm going to bring it up towards my drape line, like so. Okay, so this is where we're going to come across our bit of a problem here, which I'm going to show you how to resolve that. So I brought this up, and I'm kind of hitting a lot of resistance on the thigh, and I need to bring this part up on the medial aspect, but obviously we don't want to tuck and push too much around the groin area. So I'm going to bring it up a little bit, but this is where you're going to need your client's assistance and giving them some really key kind of verbiage on what you'd like them to do. So they're going to take their hand that's underneath the sheet and they're going to reach down between their legs. And I'm going to give them a little bit of a tactile cue just by kind of pinching this part of the sheet here. And I want them to grab that and just pull it up towards their groin. So that's making a nice tight barrier up towards the groin. And I can fold and tuck this in, which gives me a nice, clean, crisp drape line right at the bottom of that gluteal fold. So this gives me access to the adductors in this area from just below the ischial tuberosity. I have some medial hamstrings, semimembranosus and tendinosus. In front of that, I can get into adductor magnus all the way down to its attachment on the femur here, as well as a little bit more forward for gracilis and even a little bit of vastus medialis here. So this puts the adductors in a shortened position, and it's a really nice position for us to be able to use some Swedish techniques and even in something like ringing and a few other modalities in a shortened position. Otherwise, you're left to use the figure 4, which actually can start to lengthen some of these muscles out a little bit. You're also able to use range of motion of the knee from this position, move an individual around, or even some ankle movements. So it's really nice to be able to undrape both legs from one sideline position. And then obviously, if you're using the other sideline position, you'll have access to the inside of your top leg, and then you'll be able to treat the full lower extremity when this leg is up, when they're facing the opposite direction. So this is a lower leg undrape in the sideline position.